Hi, I'm Laura Turner, the Executive Director of the Student Doctor Network, and today I'm excited to talk with some of the medical research team from the TV show Grey's Anatomy. They offer a surgical communications fellowship program where a current surgery resident works with the writers to help develop and pitch medical stories for upcoming episodes. Welcome, and thank you for taking the time to talk with us today. So can you introduce yourselves and tell us about your roles on the show?
Dr. Zoanne Clack. I'm an emergency medicine physician by training. I'm an executive producer on the show, and I've been here since the pilot, so I've been here for 15 seasons.
I'm Fred Einesman, Dr. Fred Einesman. I'm one of the executive producers on the show, and have worked on this show and ER and private practice. And Zoanne and I are the two senior advisors and writers on medical aspects of the show. And Zoanne set up this fellowship to get new ideas and young blood a number of years ago. Basically, this program's for baby.
Gotta stay fresh. These are my babies.
And me. So my name is Dr. Naser Alazari. I trained in general surgery, and I have been the surgical advisor for the show since season 11. So this is my 5th season with the show.
Hi, my name is Jess Righthand. I am normally the writer's assistant on the show, but filling in as the interim medical researcher. Our medical researcher, Bridget, is writing a freelance episode of the show right now.
My name is Dr. Amir Sarkeshik. I'm a cardiothoracic surgery resident from UC Davis, and I've been involved with the show since 8 a.m. this morning.
I'm Dr. Mike Metzner, general surgery resident. I came as a fellow and now medical advisor on the show.
So can you walk me through a day in your shoes as a surgical communications fellow?
So we normally start in the writer's room around 10 a.m. every morning, Monday through Friday. And that's where we get to kind of meet and talk with all the writers in a really relaxed atmosphere where we kind of break stories. We particularly participate within the medical stories that are broken with each episode. And we are there as a resource in order to help the writers come up with pretty much the medical aspects of the story arches for each of the episodes. So we will be with the writers all day. We have opportunities to go onto set to kind of see how the production side of things are. Sometimes, we'll need people to fill in where we use our own hands when we're doing our not tying or something like that, where we kind of put that in so that it looks like Ellen Pompeo is just an amazing knot.
We need expert hands. We call in the experts.
Yeah. So it's an amazing opportunity. Every day is different. You're either breaking stories, helping writers develop their stories, or getting to see what's going on set.
Or helping actors say their words correctly.
Or helping actors.
Yes.
Or look like they know what they're doing.
Yeah.
And then prep meetings you want to talk about?
Yes, so we also participate in the production meetings so that we make sure that the medicine that is written is delivered and produced correctly and accurately as much as possible. So there's a huge team of collaborators in terms of delivering our vision so that what we see on TV is accurately as much as possible that what we see in real life. So that it's a series of meetings that we get involved into until we get the production of the episode. Also, we take part in the editing parts and also reviewing the cuts of the episode so that we see if there's anything that is missed or not portrayed as we want it to be.
Keep notes on those.
Yes.
So it's a lot of fun. Basically, the goal of this is to try and get as much current medical information. Zoanne and I have expertise in certain areas, but it's really helpful to have residents in different fields being able to sort of correct the dialogue, coming up with new techniques, things that we haven't experienced. They're involved right from the moment they arrive with helping to put dialogue in scripts, medical dialogue, correcting errors that have been made, being very involved in both the writing aspect and the production aspect. And it's also just fun because nobody really dies. So it's
creative.
I think everybody who comes through the process winds up really enjoying it and in recruiting their friends saying you should do this. We've had a lot of inter-referrals where people say, oh, my friend told me to do this, and we have. And a lot of people have gone through the program, and it's, and I think it's really well received, and it's a lot of fun. It's a, it's summer camp for doctors.
It seems like a really unique opportunity, not like anything else that a lot of doctors are able to do. Certainly, I don't know if there's a lot of other fellowships available in Hollywood that are like that.
I would think no.
I think that's pretty much it.
But it's funny because a lot of the other medical shows will try to get our fellows.
Yeah.
And they'll try to like, remember the person that you had? So a lot of our ex-fellows are actually consulting on other shows.
Oh, okay, great.
They've gotten the knowledge of how to do it, but they're in their own respective practices, but they come in and consult either by phone or sometimes in person. So I guess there is a bit of a future in the actual process.
And it has a specific design. What we wanted, this is aimed at surgical residents who are in their research years, who have elective time, and so they can come and do a non-traditional elective. It's not a full-time job for people who are already in practice. Oh, I could do this from home. No, you can't.
We need people that are going to be here and be in the room day to day, who have the time to commit to being here because things change so quickly, and we need people that can stay on top of it. So and we also had people recently who have actually finished their residency and are in kind of a limbo time. They're either waiting for their next fellowship or they're waiting for their next job. So we've also had those people, which are, a wealth of information. So.
And people stay usually between 6 weeks to 3 months, usually a shorter period of time. We're surrounded by a couple of people here who simply won't leave. But for the most part, people rotate through over 6 weeks. So they get to work on 3 or 4 episodes, and we usually let them be one of the surgeons in scenes so they can show their parents that the time was not completely wasted.
We also have fellows present cases, and it should be mentioned that many of the cases that are presented pop up in the actual show and become real stories on the show. So.
Yeah, we have them do like an hour's presentation before they leave us. I mean, through the time that we're here, that they're here, they do give us information on whatever shows we're working on or whatever stories we're working on, but then we actually have them do a separate presentation where they just have gotten a lot of their cases and they present us with those cases so that we can kind of grab from those and keep a 15-year show fresh.
Find the most interesting case that they've had, so then you're getting the best of everybody's different cases.
Interesting or weird, or the thing that made them cry, or the thing that most embarrassed them. We like those.
Yeah, it's like cases, it's situations, it's characters, people that they've worked with that we can infuse into our characters. It's just kind of keeping the show life and youth and vitality.
Yeah.
And enthusiasm.
And flavor.
But I also think it's not just flavor. Yeah, I love the flavor. But I really do believe that our part is the most quintessential part of the writing. Maybe that's just the medical team thinking this way. because we believe that every episode, the skeleton of the episode is the medicine. So everything that comes on top of it, the drama, the characters, interactions, is based on whatever the theme of the medicine that we provide. So I think our role is so essential that we can determine somehow what is this story is all about, because of the medicine and what is attached to it, in terms of the surgical interventions or what the characters are going through with the patient family or in the surgical aspect of it.
I think Grey's is very good at integrating sort of what's happening to patients to what's happening with our characters.
Yeah, I feel like sometimes people don't think that there's a lot of medicine on Grey's, which is kind of the ultimate compliment because it so just integrates fluidly into the character stories that you don't notice it. It's not like standing out at you, but the amount of work that goes into each episode is tremendous. And we talk to a lot of experts. We talk to these guys. They have friends that we talk to, and it's all a team effort.
And sorry, we didn't talk about the part of like how we go through the scripts. I think that's a very but the scripts like go through multiple processes where we, the surgical fellows, and Dr. Fred and Dr. Clack, like we had to like go over the script multiple times to correct the medicine or like put the medical terminology like for what the characters are saying. So that's also a huge. It takes weeks in order to get like, crystallized at the end.
A lot of times in the script, it just says medical, and so that's what these guys are filling in.
Yeah.
Did that answer your first question?
Yeah, I think that did. Thanks that was a very, very comprehensive.
This is going to be a fun interview. You have 9 people here. It's like, doctors, so we have the joke that 6 doctors, 7 opinions because somebody's going to change their mind. It's pretty much how the stories go on Grey's Anatomy.
But we're going in unison so far.
What is the contribution that you've made to Grey's Anatomy as a fellow that you are most proud of? What script? What storyline? What makes you feel the most proud?
Oh my God, I think I have. Well, I don't want to say that I have a lot of them. Shall I start? Like, Michael, do you have? Well, I mean, one of them was like I did pitch a medical breakthrough for Meredith Grey, the protagonist of the show, of how she can win a Harper Avery Award. It's like a prestigious award that we have established in the show. So we kind of like structured that medicine to reflect actually her personal story, which is about like breaking walls and restructuring herself. And we did like come up with the abdominal wall transplant. We contributed also to a lot of things that we got awards for, like the maternal mortality, the inflammatory breast cancer case. I mean, all of us here, like we contributed in so many things that, it becomes like it's a teamwork rather than just like individual work in the end.
But there are definitely some things that get pitched that don't belong to the person, but
my favorite, let's see, this season, it's aired already, so it's okay. But I had one of the writers come up to me and say, okay, so the theme of this is going to be unhinged. Give me a medical scenario. And I was like, okay, well, a wandering spleen because it's untethered to the abdominal wall. And then, okay, well, we need to make more dramatic. Well, it occurs more often in pregnant women. And then, okay, more dramatic. And so, all right, well, the wandering spleen could then torse. And then untorse, and then she could really bleed out, and so then we'd have to do an emergency delivery of the baby, and so that was earlier on in the season. So
that was one of Michael's stories. The contributions, some of them are personal stories, some of them are about our families and friends and the fellows. Zoanne and I have been doing this for a really long time, so we're running out. And so so the nice part is have fellows come in and go, here are 10 things that happened to me in the last 3 months. And that's like, oh, well, we've got another season. And I think that's really the helpful part. Because even if it's not the specific story that they're telling, there's always a detail, always something that leads to something else. And that's the fun of this. It's always, it never winds up being what we start off with. But hopefully it always winds up being a little better. And that's what we're aiming for. Right. And it's fun.
And 2 that I can think of that a recent fellow gave us for this past season were the clamshell, which, I mean, each of us could have thought of that, but he had like a case where, the person survived and we kind of went with that. And then when Owen got the succinylcholine pushed into his IV, that was from him. So we've gotten just like stories of like very specific stories from specific residents. And also it should be noted that just talking about resident life is an important aspect that they bring. Obviously, Fred and I haven't been residents for a number of years. So it's good to see like how it's changed, the hours and things, how that's affecting people now, and if they think that's a good thing or a bad thing, and how people, with the Me Too movement, how that's changed residency. So keeping up with the times, they've been able to tell us not only just like medical cases, but also just like living in residency, which I think is obviously a big part of a teaching hospital, which is where we set Grey's Anatomy.
How has your time as a surgical communications fellow impacted how you work as a physician?
My personal, because I'm back at practicing right now, and actually I think it immensely affected me as a physician and also as a writer. The writer aspect, I learned a lot from the writing process that happens in the room, and it's enabled me I can synthesize a plot, or how can I be very consistent with the story arc. As a physician, I think it helped me in so many ways I can't even count them. But one of the ways is that we research new innovations in surgical practice or even in medicine all the time. And I think me personally, I learned a lot when we did the research last year. We delved into the world of nanotechnology and microchips that are used in medicine. And I think that really, because in surgical practice we're have very monolithic kind of knowledge that we just learn what we are taught to practice. It's more a skillful aspect, not like the research aspect of it. And I think in the show I learned a lot. The other part is specialties, because we only I trained in general surgery, but when I have to pitch stories for cardiothoracic or neurosurgery, I start to look for stories or even learn from guys like this one here or any of our consultants. So it definitely expanded my knowledge in other specialties.
Yeah, you definitely do a lot of research. I just had to take my app site actually while here, and it's funny because I would say the majority, but there were a number of questions that were actually different scenarios that we've done on the show even this season. So I was just oh wow. So I had my app site book out on set, and I'm watching the monitor and then studying a little bit. But it really is amazing how much you actually learn that you would never in a million years would have learned just from surgery residency. Another thing that I think that I've found is that in surgery residency, we're always around trauma, in so many cases, and we see such horrific things that in that moment, we don't really have time to process and really reflect on those situations. And I think the thing that caught me by surprise so much as being here is I'll be in a scene running a code, which of course we've all done that a million times, but we've never, at least personally, I haven't had the time to reflect on things like that because as a resident, that we're just doing a million things at once. And so being here, it's really given me that time, and I think it's very cathartic in a way to really process the humanity of medicine. And so that's been something that, while here, I never thought that would happen, and it's been very pleasant surprise.
No, I think Michael, you struck a right note, because I really felt, and I hate to say that, but I think medicine dehumanizes us because we have to be functional and not emotionally involved. And I think because the tone of the show is very drama based and emotional, we have to really reflect on these things. And in fact, on what Michael was saying, it's absolutely true, and it's happened to me personally, because now when I'm back to practice, now I've become a better listener to patients, so that I can hear what they're going through and then counsel them better instead of just giving them treatment.
Michael and I give a lecture, and one of the points of the lecture is how TV made me a better doctor. And I think it's true in some ways for everybody, because there is a sensitization, a desensitization in the real world and a resensitization when you're doing the artistic interpretation of that world. And for all of us, we pitch stories and we're sort of objective about it. Then you see them up on the screen and people are emoting and people care, and you get all choked up and say, well, wait a second, that actually happened to me. And I didn't have that emotional response while it happened, but now you see it and you do. And I think that in some ways resensitizes all of us, and in the end winds up making us better people and hopefully better physicians as well when we continue to practice.
I would agree 100% with that. And just going back to what Naser was saying earlier about breaking boundaries, it's really interesting that you live within the certain boundaries in medicine, and these writers don't have those boundaries. So all they have is imagination. And so they'll come up with scenarios that you're no way is your first initial reaction. You push that down.
Yeah.
And then you try to figure out how it can work.
Yeah.
And you talk to experts and you talk to different people, and things just start formulating in your mind about how it just opens up everything. You're learning to use your right and left brain and integrate them more, which leads to the empathy and all of the things that we were talking about. But also, I feel like for even research, like people who want to do research, these are how innovations happen. It's because you open up, you push boundaries, you think outside the box, all of those cliches, but you can learn that here. And that is one of the things that it took me by surprise as I was, coming up in this. So I think that that's another piece of it that helps to add to your practice.
What's the process for putting together a script or an episode? How does it start, and how do you choose what medical diagnoses to put into the episode?
We pick one, and then we pick another one, and then we pick another one. The writing process is really fluid because you're trying to tell a story, and so there's all sorts of, hey, this is a really interesting thing, and then we play around. The writing team, of which there are many more of them than us, start to talk about things, and you find out that the medicine we're talking about doesn't work. Sometimes it does magically, and it doesn't. So you say, oh, how about this? And we're always trying to make it fit into a theme of some kind. The theme changes as it evolves. It's fun because you start off on day one. You're never going to recognize what you wind up on day 20. It changes virtually every day, sometimes 4 times a day. And so we're constantly trying to modify the medicine or coming up with something new, or simply trying to relate to something medically that fits in with the story we're trying to tell. The medicine on the show is the frame. It's the frame that holds it together. It's what allows people to sort of believe in us because the medicine is really good. But the stories are what matters. I was taught in film school that, it's 3 things you need to know, which is story, story, story. And that's our job. Our job is to make sure that the stories work. If the medicine is really incredibly precise and incredibly interesting to us, it may not work because the story may not work. And so we have to all be flexible. We all love being doctors, but we all love being storytellers as well. And so one of the goals of the fellowship is to help people become better storytellers, because that's one of the goals. And I think it's one of the fun things about this. I don't know if I should tell the CDC story, but it's my favorite story about how this works. Because every script not only goes through all of us, of which there are many, it also goes to outside reviewers. So we have doctors reading them, and it's when we're working and doing research on things, we always call people. And my favorite story is when you call up like the head of I'm making it up, the head of immunology at the CDC, and their reaction is always, that'll never happen. And then you just go, well, it may not never happen, but it's, it could happen.
What are the circumstances that would lead to it happening?
And they go, it's, okay, it could happen. It's 1 in a million. I go, well, have you seen our show? Because that's what we do. So, okay, let's say it's 1 in a million. So, okay, well, if it's 1 in a million, could this happen? They go, well, and they're still, okay, it's 1 in a million, but yes, that could happen. I say, well, if that happens, is there anything else? And then you can hear it. And then you can hear the little valve go off in their head. And they go, well, if that happened, what would be really interesting? If this happened. And then you've got them. Because what's happened is they've switched from being doctors to storytellers. And it becomes like, oh, that's really great. We should use that. They go, what else would happen? Maybe this would happen. And you go, oh, that's great. How about this? And suddenly now they're part of the writing team. And they are pitching ideas. And so the story that would never happen it's 1 in a million, the end result is always, well, this is a really good story. When is this on? I'd really like to watch this.
Yeah.
That is a universal response. And that's the goal of the fellowship, is to say, yes, we know it's far-fetched. That's why we all do well on our board exams, because we're doing the rare cases that they actually ask about on the boards. So it's always astonishing that you look at your boards and go, oh, yeah, we did that on grades.
Right.
Because that's what happens. But the truth is, this whole fellowship is about people who want to develop that side of themselves, which are storytellers. They get to participate in the medicine. We take that because that's the value you give to us. But what we give to you is we make you better storytellers. We make you part of that artistic part of your brain. We allow that to be expressed. And I think that helps you in the world in so many ways.
All of that, yes. And then practically, the way we get our medical stories is through these guys when they just pitch out stories. Also, our medical researcher will look at cases in the news and that sort of thing every day and give us updates about what's happening in the world. And sometimes some of the writers will give her things and she'll post those so that all the writers have information on different new things that are happening. And then we'll just have like a list of medical cases that we sometimes do like twice a season, sometimes. Definitely at the beginning of the season, just like all these fun medical cases that we have, fun or tragic or weird medical cases that we've all heard about and learned about through word of mouth or journals or news articles or whatever. And we'll draw from those cases. But sometimes we're in the room and they say, we want this person, and this person to be together. So you have a neurosurgeon, a plastic surgeon, and a general surgeon. How can we get a case where those three people can work together and talk about the theme of love?
Right.
And that's something to do with what the medicine is talking about. So maybe we have a cardiothoracic surgeon in there too, because it's about the heart. So, we have to bring these people together and we try to find the medical case that is going to speak to the theme, to the characters, and to getting us where we need to go with the medical case. So it starts on two different levels.
And I think that the second level that Zoe mentioned actually is the most difficult that we usually experience, because you are put in a corner and you have to be creative. You have to be very comfortable with your fund of knowledge, and you also have to be creative. So I'll give you an example. Like one time we were asked that there's this character that has like, a bad relationship from the past, or her heart is scarred from that relationship. So we need to find a surgery that is like with the theme of like scarred heart, like something in medicine. So when we practice medicine, there's a condition it's called primary amyloidosis, which is like deposition of like proteinaceous, did I say it right? Material in the heart. When we study medicine, we don't think about it as scarring of the heart. We think it's just an abnormal process. But when you start to go and like live like the drama of the show, you start to rethink the thematic aspect of the medicine, which actually helps us in the future to build more stories, because you understand like the primary components, and it helps us to create these stories for these I call them tailored medicine. Tailored medicine because we want, it's for the future. So yeah, I mean, it goes both directions, I guess.
Great. That's a really great overview of the process and what you're looking for. If a Student Doctor Network member wants to apply, what is their process for doing that? And what do you look for in a candidate?
We give them Zoe's home number and
Call every hour. That's
Actually,
how you do it.
There's a hotline.
What do I do?
Jess sends out an application to, I guess we're doing it to the residents, and also just if you have questions, I think, there's a Grey's Anatomy. Yeah, there's a Grey's Medical Communications email address that you can email us and get more information and get the application and that sort of thing. And then what we're looking for is people who are mostly we want surgeons, because Fred and I are emergency medicine docs, and we like people who can fill in technical details, such as which instrument to use, because it would take us like an hour to find that. It's right at their hands. So we like surgeons. Usually, and we like people who are going to have the time. So if you're doing like a massive fellowship where you're not going to have time, but you think you can kind of come in, for a couple of hours a day, then it can't really work. We need to have someone who has dedicated amounts of time. Like Amir here has 2 weeks that he can give us because he's on vacation, and he can give us that full 2 weeks. So because of that, we are able to bring him into the fold. And
it was us or Hawaii who chose us.
Yeah.
We're going to squeeze his knowledge.
Yeah, we're going to squeeze it for all we got. And sometimes we've had people that have come for a week or 2 weeks who are not technically fellows, but are welcome into our family and act as fellows. With the paid fellowships are the 3 months, 6 weeks to 3 months. We've never had anyone for 6 months, but people who have the time to dedicate and have a huge interest in either communicating public health issues, or we've had some former actors apply, people who, like, Naser was wanting to write write a memoir, and so he has the writing bug. So we really like people who are open and willing to, learn how to integrate the right and left sides of their mind and really want to do that and want to communicate. And people who have been impacted by the show. We've had some people who have been like, especially a lot of women of color have said something like, Dr. Bailey inspired me to like go on this course, so it would be wonderful if I could be a part of the process. So people who have been inspired by the show and understand the responsibility that we take seriously on the show, those are people that we welcome in, and it's worked out pretty well. Like, we've been really happy with everyone. And again, people have gone on to consult on other shows and really be in this. So I think that everyone has had a pretty good experience that we can. And then, of course, we just keep some people.
So thank you very much for giving us such a great overview of the program and providing such great detail. I think you'll get a lot of interest in it. I know that it seems like it'd be a really interesting and different experience for someone who meets those qualifications. So thank you again for taking all this time. I really appreciate it.
We love having people come in, and we like to have choices and interest, and we try to accommodate as much as we can. So.
Yeah. Because I can tell you, like, every time we have a new fellow, we learn different things. Like, we get new stories. Like, these stories are never ending. Seriously.
Sure. Thank you for your help.
Yeah.